Welcome to this video demonstrating how to perform a full neurological examination. Whenever time permits, it is important to do this rather than a focused examination to ensure that important physical signs are not missed. To begin the examination, you must start with wiper. Wash your hands, introduce yourself to the patient, stating your name and role. Ask permission and check if they are in any pain. Expose your patient appropriately and reposition the patient as appropriate. In this instance, it is helpful to observe the patient's gait as they walk into your clinic. You should observe whether there is any evident weakness of their limbs when walking, whether they swing their arms normally, and you should test for coordination by asking them to walk heel to toe. Complete this part of the examination by performing a Romberg's test. Assess balance by asking them to put their feet together, stand still and look ahead, firstly with their eyes open and then with their eyes closed. Okay, if you'd like to just pop on the bed for me. Can you manage all right? Now position the patient sitting up comfortably on the bed. Start the examination by asking whether the patient is right or left-handed. Hand dominance is clinically significant. First of all, are you right or left-handed?
Right-handed.
Thank you. Now test for aphasia. Can you close your eyes for me? That's brilliant. Okay, if you open your eyes, just puff out your cheeks. Brilliant, thank you very much. What do you call this, sir? Brilliant. And what do you call this?
That's the rim.
And this?
A comb.
And what do you call this?
The teeth.
Brilliant. Can you say for me Prince Regent Street?
Prince Regent Street.
Perfect. Move on to test the patient's mental state by performing a simple general knowledge test and then a memory test. Can you tell me what this place is?
University College Hospital.
That's right. Who's the Prime Minister?
Theresa May.
You can remember that. And who's the President of the United States?
Donald Trump.
Everyone, I think, knows that. And then, can you count backwards for me from 20?
20, 19, 18, 17, 16, 15.
That's perfect. And I'm going to give you something to remember, and I'll ask you during the examination. It's just testing your memory. It's 4 East Street. So 4 East Street, and I'll ask you later on in the examination. We will now do a cranial nerve examination. The first cranial nerve is the olfactory nerve. You should test smell by asking the patient to recognize the smell of common objects with their eyes closed. Can you smell this?
Mm-hmm.
Okay. What do you think that is?
Coffee.
And then here?
Coffee.
Okay, that's brilliant. Thank you very much. The second cranial nerve is the optic nerve. Test the patient's visual acuity by asking the patient to read small print by near vision and large print at a distance. You should confirm whether the patient wears glasses prior to the assessment. Now use a bright light to test the patient's pupil reactions, testing one eye at a time. It is important then to sit the patient up and examine the fundi of each eye using an ophthalmoscope. You should use your right eye when examining the patient's right eye using the ophthalmoscope and your left eye when examining the patient's left eye. Now test the patient's visual fields. It is important that you and the patient are correctly positioned so that you can align your visual fields with those of the patient. You should then bring your fingers in from each of the quadrants of the visual fields, both temporally and nasally. If you keep this eye closer, and I'm going to bring this finger in, just stare at my eye.
Mm-hmm. Mm-hmm.
Keep staring at my eye.
Mm-hmm.
You should now test the third, fourth, and sixth cranial nerves for eye movement. The sixth cranial nerve, the abducens, controls the lateral rectus muscle for looking outwards. What I want you to do is just to follow my finger as I move to one side, to another side. The fourth cranial nerve, trochlear, controls the superior oblique muscle, which enables the eye to look up and out. And then look out, out, and up, and out, up. The remainder of the movements are controlled by the third cranial nerve, the oculomotor nerve. I'm going to go up and down. While testing the lateral gaze of the patient, please observe whether nystagmus is present. Hold the finger there and hold the finger. To test accommodation of the eyes, ask the patient to look at a distant object in the room and then to focus on your finger. Now test the fifth cranial nerve, the trigeminal nerve. This nerve has both motor and sensory functions. Test sensation to touch over the three divisions of the nerve, ophthalmic, maxillary, and mandibular. You test the motor function by asking the patient to clench their jaw whilst you feel over the masseter muscles. Complete the motor examination by testing the jaw jerk with a patella hammer. Finally, you should test that the corneal reflex is present by carefully stroking both cornea separately with a wisp of cotton wool. Now test the seventh cranial nerve, the facial nerve. The function is tested by asking the patient to tightly close their eyes and seeing whether the eyes can be opened by your fingers, asking the patient to frown and asking the patient to blow out their cheeks, testing the strength of the action. Now test the eighth cranial nerve, the auditory nerve. You should test the hearing initially by whispering to each ear. If there is an impairment, define whether it is due to middle ear disease, conductive deafness, or to a lesion of the nerve, perceptive deafness. Can you hear that?
Yes.
What am I saying? Rinne's test is a comparison of the noise heard by a patient from a tuning fork, firstly held on the mastoid bone and then close to the ear. Can you hear that, sir?
Mm-hmm.
Tell me when you can no longer hear it. Still hear it? Can you hear that, sir?
Yes.
Weber's test may also help to distinguish between unilateral conductive and perceptive nerve deafness. A tuning fork placed on the centre of the forehead is normally heard equally well in both ears. Where do you hear this? I'm going to place it in the centre.
All around.
Okay, is it in the sort of centre of it? Thank you. Now test the 9th and 10th cranial nerves, the glossopharyngeal and vagus nerves, by observing whether the uvula is central and testing the gag reflex. Can you say "ah" for me? Lovely. I'm just going to touch the back of the mouth. Sorry, it's not very pleasant. Got it? Okay. The 11th nerve is the accessory nerve. Test the power of the sternomastoid and trapezius muscles by asking the patient to shrug the shoulders while you push down on them. Shrug your shoulders up for me, nice and hard. That's brilliant. Okay, fine. Relax. Push me away with your jaw. Good man. And again, this side. Very good. Finally, the 12th cranial nerve, hypoglossal nerve, is purely a motor nerve. Look for wasting or abnormal movements for circulation of the tongue, and then ask the patient to protrude their tongue. A unilateral lesion causes protrusion towards the side of the lesion. We now go on to examine the motor and sensory systems. We have already observed the posture and gait of the patient, which may give immediate pointers to nervous system disease. You should observe the patient lying on the examination couch. It is important to observe the patient's overall musculature, including muscle groups which are not visible with the patient lying flat. Wasting of muscles is evident from a reduction in bulk and a flabby appearance. Look also for any involuntary, spontaneous movements of the limbs or tremor of the fingers. To test for tone, gently move the limbs in all directions to confirm neither flaccidity or increased tone. The strength of individual muscle groups in the arms and legs must always be assessed. Each movement should be compared with your own strength or with what you regard as normal power for the patient. It is easiest to make an assessment of power starting from the shoulders and then working down. If you hold it up, don't let me push it down. That's lovely. And again, that's brilliant. And spread the fingers out. Don't let me push them together. That's excellent. I'm now going to do the legs. So firstly, if you could lift this leg up, that's right. And I'm going to try and push it into the couch if you stop me. That's brilliant. And I'm just going to test the other leg. Lift the leg up, don't let me push it down. That's very good. Now, if you push my hand, I'm going to try and lift your leg. I want you to push my hand into the couch. That's good. And there. That's very good, sir. If you could bend your knee and pull your heel up to your bottom, just do one leg at a time, if you wouldn't mind. Pull your heel up into your bottom. I'm going to try and stop that. That's very good. And if you do the other leg, so if you, and I'm going to stop it. That's brilliant. And if you could cock your feet up, and don't let me push them down. Don't let me push them down. And if you could try and move your foot out, that's very good. And this one as well. That's very good. Okay, sir. I'm now going to test the reflexes. Testing the reflexes assesses the reflex arc and the supraspinal influences which operate on it. If the tendon of the stretch muscle is gently struck using a reflex hammer, the muscle briefly contracts. Begin by testing the reflexes in the upper limbs, the biceps, the supinator, and the triceps. Then go on to test the reflexes in the lower limbs, the knee jerk and the ankle jerk. In patients where reflexes appear to be absent, you should ask the patient to grit their teeth or clench their hands to see if this reinforcement results in a reflex jerk. In patients where reflexes seem abnormally brisk, you should test for clonus by briskly dorsiflexing the foot. If clonus is present, the foot will continue to jerk backwards and forwards. Complete the reflex examination by testing the plantar reflex, the Babinski response. This is elicited by applying a firm pressure, usually with your fingernail or a neurotip, along the lateral border of the dorsum of the foot, and observing the metatarsopharyngeal joint of the great toe. In the normal circumstance, the toe flexes, it goes down. In upper motor neuron lesions, the great toe shows an extensor response. It goes up with an associated fanning of the toes. Now test the limbs for coordination and sensation. To test coordination, you should first ask the patient to touch your finger and then their nose. Dysdiadochokinesia is the term used to characterize an inability to perform rapidly repeated movements. You should remember to ask the patient to repeat the sentence you gave them at the beginning of the examination. Can you remember that question I asked you at the beginning?
Yes.
What was it?
4 Easter Street.
Thank you very much. For the lower limbs, they should be asked to run their heel down the shin. These should not be tested if the patient has significant weakness in a limb. Light touch is tested with a wisp of cotton wool applied at a single point with the patient's eyes closed. Do not drag the wool across the skin, as this sensation may be transmitted via pain fibres. Say yes every time I touch you. If you could close your eyes.
Yes. 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 Yes.
Pain is best tested using a specially designed neurotip. A needle point should be avoided because it may easily puncture the skin. First test that the patient can feel the stimulus and understands what to do by testing on a part where you know the sensation is normal.
Yes. Yes. Yes.
Feels the same on both sides.
Yes. 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 Yes.
Do you mind if I just feel the abdomen?
Mm-hmm. Yes. Yes. Yes.
Just work down the thighs.
Yes. 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 Yes.
If the sensory loss looks as if it's in a glove or stocking distribution, start at the tips of the fingers or toes and work up until you find a sensory level. Vibration sense is best tested using a C128 tuning fork, testing both the lower and upper limbs and the trunk. Can you feel that vibrate?
Yes.
Can you feel it? Let's put it on your vibrate there. Excellent. Very good. Proprioception, joint position sense, should be tested with the patient's eyes closed. The finger or toe should be separated from any adjacent digits and the joint being tested moved up and or down. Ask the patient which way the digit is being moved. This is moving your finger up and moving your finger down. Can you close your eyes and just say which way I'm moving your finger?
Down. Down. Up. Up.
Brilliant. And let's just do this hand, sir.
Up. Up. Down. Down.
And I'm just going to do this with your toe now. That's up.
Down. 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 Up. 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 Down.
Excellent. It is difficult to test temperature in the normal clinical setting, but this should be tested if you are concerned that it may be abnormal in your patient. You should complete the examination of the nervous system by assessing the related structures. These include skeletal structures, the skull and spine, extracranial blood vessels, and the skin. The shape and size of the skull must be observed and the head palpated to look for bony defects or swellings. You should examine the spinal curvature and palpate for local tenderness all the way down the spine. In addition, you should test spinal movements. Remember to listen over the carotid arteries for bruit. You should also examine the skin for vascular malformations, neuromas and café au lait spots, which may be seen in association with certain neurological diseases. On completion of the examination, you should offer to help the patient dress and then wash your hands.